Hi, my name is Dr. Jennifer McMahon. I'm a senior lecturer in the Department of Psychology here in the University of Limerick. I work in the area of mental health with a specific focus on young people and children's mental health. So in relation to mental health, science can help us understand our feelings and our emotions. Our feelings and our emotions are these constructs that, we all experience every day, but sometimes our thoughts, our feelings and emotions can be overwhelming and lead to mental health difficulties. So science can really help us understand what is the events that lead to difficult thoughts, feelings and emotions, and more importantly, how can we intervene to support somebody to come back to a feeling of well-being and positive mental health. One of the key areas that we can look at through the lens of science is looking at what we call active ingredients in interventions. So for example, what works for people and when. This is really important in terms of understanding the drivers of change in relation to our mental health and developing positive emotions and feelings that we can deal with in our everyday lives. For example, with genetics, we know that there is a genetic component to many mental health issues, for example, depression. And we also know that environmental factors are really important. So adverse early life experience, things like poverty, neglect, trauma, they're all really important factors in the onset of mental health issues. However, we need to broaden our understanding of what contributes to mental health issues and include other factors such as intrapersonal factors or interpersonal factors as well. Our research here focuses particularly on school context because school is where a lot of young people spend most of their time. So an example of the research that we do is a program called MyPsy, which is short for My Psychology, or Mental Health and Wellbeing in Youth through Psychological Science. So this is a programme of research funded by Science Foundation Ireland that brings together key stakeholders and collaborators to design and develop a 12-week programme that can be delivered in schools to promote mental health and well-being in adolescents, particularly transition year students. What's really interesting about this research is that prior research that we conducted indicated that oftentimes efficacious treatments or interventions that we know that work often don't get deployed in schools and in youth contexts, and this can be because of a whole host of reasons, but usually because the interventions themselves do not take account of the needs of young people or the needs of teachers or the needs of the dynamic and busy school context. So what we've done through this programme of research is that we've collaborated with young people, with teachers and a whole host of youth-focused providers such as Jigsaw, the Health Service Executive and University Hospital Limerick. We're also a key partner with the Limerick and Clare Education and Training Board and the Junior Health Sciences Academy here in UL to design and develop this really innovative programme that we can deploy in schools. It's currently being rolled out in 5 pilot schools at the moment, and we're working with the young people to assess the effect of that programme and also to kind of redesign it for scaling it up in the future. There's a whole host of research looking at the various different contributing factors that lead to the onset and development of mental health issues. So for example, in Trinity College Dublin, they're researching biological intervention of psilocybin, which is the active ingredient in certain mushrooms to treat depression. In the University College Cork and here in the University of Limerick, there is a whole host of research looking at the social determinants of mental health, which focuses in on issues of trauma, looking at early adverse experiences, looking at neglect and social deprivation as factors contributing to the onset of those issues. And in the research lab that I direct, the School, Child and Youth Mental Health and Research Lab, we're really interested in the onset and development of mental health issues in children and young people. In particular, adolescence is a key developmental stage for the onset and development of mental health issues, and we know that early intervention is critical at this period to prevent poor outcomes later on in adulthood. There's never been a better time to access information. So there's a range of podcasts, websites and online resources that people can find out a little bit more about the issues that they're concerned about. For example, the HSE have a great list of books that people can read on various different aspects of concern. It could be issues around depression, anxiety, eating disorders and so on. And Jigsaw also have a really good self-help list as well that relates specifically to young people and adolescents. We also can engage with a therapist or a psychologist if we want to create a deeper understanding of what's happening for ourselves. And all therapists and psychologists will engage in what we call psychoeducation, which is an explanation of the processes and mechanisms that underlie mental health issues and challenges.